Welcome in, everybody. Today I am giddy. We have Dr. Robbins. He is a plastic surgeon, award winning plastic surgeon based in Nashville. And you guys have to check out his social media after this interview because he is, I'm just meeting you now, Dr. Robbins, but I find you to be just fun, relatable, interesting, and I feel like I just want to know you so much better. So thank you for coming on.
It's my pleasure. After that introduction, I hope I don't disappoint.
No, not at all. Okay, Dr. Robbins, I have so many questions for you because I want to start off by saying I'm from LA and I grew up in like an industry family, and my mom was obsessed with plastic surgery. She didn't get a lot of it done, but we'd always go to parties and there would be women that were like dripping in diamonds and just like the rich of the rich. And they would always talk about surgeons and then they would have like their faces done. And she'd be like, oh, I don't like that neck. Oh, I don't like that. Oh, I got a boob guy for you. So as a little kid, Dr. Robbins, I was literally like 5 years old on with my mom taking me to plastic surgeons' offices. So I feel like I know the world, but I don't know the world like you do. So I'm really excited to ask you a bunch of questions.
I'm happy to be here. And the world's changed. I mean, what a cool introduction to the specialty. But yeah, even then, it's changed some over time. And I think you have some questions about that stuff,
I have
more
lots of questions.
contemporary
Okay.
stuff today too. So.
Yeah. So let me ask you a question. Why did you become a plastic surgeon? And why did you get in the medical field to start with?
Yeah, those I would two questions. So medical field in general, I was a science nerd. Um, it's interesting because I have a daughter who's a senior in high school, and watching her find her interest, and but I was like that too. I was a student. I liked school always. I was really into science, and then in college, biology. So that was sort of my passion. But that led me to the medical field. But the pathway to plastic surgeon after you know application and acceptance to medical school was much more circuitous. I mean, I never intended to be a plastic surgeon, but along the way, I was introduced to, well, I've made a decision after med school to do surgery, general surgery, and then got exposed to plastic surgery and then did a fellowship, a residency after that, then got exposed to aesthetic surgery. So that's kind of how I ended up where I am now. But along the way, probably like most people in their careers and journeys, I mean, standing on the shoulder of giants, there were a lot of really great people that helped me, a lot of great attending physicians, as we call them, teachers, professors, that cared. And I found their mentorship and guidance really helpful, and it's just some awesome people along the way.
It's awesome. I always get interested in this. Are you a good artist? Because I see your work with bodies and they're beautiful, the work you do. But can you take like a pen and draw?
Actually, I just got our journal. We have one of our trade journals that I get. Oh, I get a few. This one oftentimes will have a cover of a painting or a drawing on it, and it's always attributed to some doctor who is a member of the society. Um, no, I don't really have those interests or hobbies, but the way I think about it is, I would use the analogy of music. I mean, if someone can't hear the notes, they can't play the song, and there are people who can't hear the notes. So I think with aesthetic surgery or cosmetic surgery, you have to know what pretty looks like. You have to know what's beautiful, even though you can't necessarily paint it or draw it. Um,
Wow. That's pretty cool. And why is it called plastic surgery?
yeah, that's a really common question, and it comes from the Greek word plastikos, which means to mold or to shape, which is essentially what we're doing with tissue, with soft tissue.
That is
Yeah.
so cool. Thank you for that. Okay, now the questions are coming up. So since you said it earlier that cosmetic surgery has changed over the years. What is a myth about plastic surgery that just bugs you? Do you have one?
Ooh, how many? Yeah, how many. Um, One is probably the most common thing I get is that our patients are crazy or unreasonable. And, while we do they can be, but in general in general, they're not. They're reasonable people with reasonable concerns or requests about their bodies or faces. And so that's we find that not to be true. A few others. There a lot of people think plastic surgery patients want to look different. And some do, but a lot of what we do is, I would say, more restorative, especially, after having children, a mommy makeover, that's to restore the shape or volume of a breast or, the shape of an abdominal area after the muscles or skin have been stretched. Or facial aging is a good category. A lot of, people don't necessarily want to look different. They just want to look like a more rested version of themselves. Because I think this next one gives a lot of patients anxiety. They feel like the results or outcomes are permanent, but they're really not. They can be, but most of the time, a good plastic surgeon can change or modify lots of things.
I have a
And
question on the back of that
yeah,
real quick in a
yeah,
minute. So I grew up with Michael Jackson. My dad would train Michael Jackson coming to the house, right? And so we met him, going back to plastic surgeons, we met him through his plastic surgeon. In my opinion, his plastic surgeon should have stopped. Now, with Michael Jackson's face and nose, if he was alive today, how hard would that be? Because you said it's nothing's permanent. But when the nose gets that, shaped and gone, can you restore that?
yes. It won't
Oh,
look as good as the original nose, but yes, and nasal reconstruction is a whole thing. There are people who specialize in it. So some people lose their noses. Wow, I've seen the last one I saw was, I think, it was a bite. That's kind of weird, but yeah, people lose noses in trauma, um, or from cancer, not uncommonly. And so I think essentially the pictures, I don't know a lot about Mike's situation. Um, from what I understand, sort of at the end, he didn't have much of a nose left. But yeah, there are techniques to reconstruct or rebuild a nose. It's not a one stage procedure, um, and I could tell you more, but it's not my specialty either. But yeah, it can be done.
okay. And then, okay, going back. So we did the miss. I know you probably have more, but put a pin in that. And then what is the weirdest, like a Michael Jackson, like what is the weirdest request you have ever gotten? I bet you hear it all.
The weirdest, I don't think I can answer that question because I think it would betray the confidence of people. But it would make some really good stories. I don't know. I should probably write them down when I'm gone and the patients are all gone. Maybe somebody would have a good story to tell.
Yeah, there you
but
go.
but no, I think we have to maintain confidentiality, and I've been asked to do some really strange things. Some of them are very interesting, and some of them I've done. To be sure, but probably not things I should talk about.
I like that. Keeping confidentiality. I like that, Dr. Robbins. Says the
Some of
character
them are
in you.
so weird, they've gotta be one of a kind, like that person, if they heard this podcast, they would know.
Yeah, it gets me. Okay, I love all of these questions. Thank you. This is so fun. And also, I just have to say, I've met a lot of surgeons, and I just think it's important. That's why when I saw your Instagram, you're so relatable. You seem like you just have great bedside manner. You just seem like, because some doctors, I'm like, I don't want that person to get near me, let alone touch me. So you just seem like a guy that, is just quality. So I just want to put that out there for you.
You're kind, you're very kind, Shauna, thank you.
No, I really mean it. I've met a lot of people in my life, believe me. So, no, but I also with doing this episode, I want people because a lot of people, there's a lot of myths, there's a lot of stigmas, there's a lot of surgeons out there that I've met personally that are like, oh, you need to get this, this, and this done, make people feel not great about themselves. But it seems like you don't want to change who a person is. Okay. This is the one. So I look at faces all the time. I look at bodies. What is a procedure? Because I feel like what you do is kind of like the Olympics when you look at somebody like doing the triple axel and you're like, oh, that looks easy. Like what is a procedure that you do that looks easy but is really complicated?
Probably the most common thing that fits that description is probably one of the most common things we do, just breast augmentation. I mean, it is super common. I think, like a lot of things that are common, when it's fairly easy to do the procedure, you find a lot of people outside of the label plastic surgeon doing it, right? There are a lot of non-plastic surgeons putting in breast implants. But good breast augmentation is so nuanced, so complicated. But I think anybody can stuff an implant. That's not hard.
Dr. Robbins,
It's
that's
really hard
legal?
to make pretty boobs.
That's
And
legal? Like, any doctor can do that's something new. Any doctor can do a boob job?
the language on that is really pretty vague, and a lot of people take advantage of it. But yeah, we've got general surgeons here doing breast augmentation. There are ear, nose, and throat doctors or otolaryngologists doing breast augmentation. Probably it's the same in California. I think it's the same. Yeah. Yeah.
That's
So
unbelievable.
just because you can stuff an implant doesn't mean you can make pretty boobs, or that you're even skilled or have a good understanding of breast aesthetics. And super breast augmentation is super nuanced. And not only is it just a matter, like a lot of what I do is a matter of taking a person's anatomy and matching it to my skill set to get the outcomes. Breast augmentation, to some degree, rhinoplasty or nose jobs. Really, it's the patient's anatomy. It's my skill set, but it's also their wishes or their desires. And so, during that conversation, there has to be great communication between the patient and the provider. We have to understand exactly what the patients want and making sure that our skill set aligns with that so they can get the outcome that they want. Um, the surgeon has to be able to see the vision or the breast aesthetics, as we say. Just because you have volume in there doesn't mean it's pretty. Beautiful breasts have volume, but they also have excellent shape, symmetry, and ultimately are well proportioned to that person's physique. And so that all needs to be considered. So, um,
That's so good. And I love and I saw on your Instagram that you do consultations and with groups of people and educate people.
we've done for a little while, and in that sense, anybody who comes into actually stole that idea from from another surgical specialty, because there are surgeons who are super specialized in what they do, meaning they just do the same operation over. The example I'll use is like bariatric surgery, like weight loss surgery. So they would group patients into an information session, and just because a lot of the information you give is the same patient to patient. But I found in the group setting, it's also a nice opportunity for people to have the support and company of other people with common interests, and also to shared inquiry, shared interests. I mean, sometimes people will ask questions in a group setting that another person might be self conscious or afraid to ask. But that's the only thing about those group consults that's group based. Everything else about it is customized, just like any consultation here would be. So after the little group information session, we break out and do individual consults where we're sizing patients, measuring them, looking at their anatomy, and talking about more customized details like that.
I love that you offer that because I just feel like a lot of people are just nervous to even schedule for themselves so they can just feel like they can come in and they're not on the spotlight and then they can learn. I love that. That's a
Yeah, it
really
works. It works for some people and some personality types, and others not so much. I mean, by far the vast majority of patients, we still want an individual consultation, which is
yeah,
fine.
being
Yeah.
private. Yeah. Okay. Here we go. Which era had the worst beauty trends surgery-wise? 90s, 2000 now? Like, I'm looking at some of these girls now, I'm like, "What just happened?" Talk
Can,
to me.
can I give you the Harvard answer? What do you think? Well, let's go through the decades. You want
Okay,
what do you
let's do
think of the 80s?
80s, I feel like there was a number 1, number 2, and number 3 no's. I feel like everybody kind of had it. Am
The
I
ski
wrong?
jump, the overly reduced ski jump, yeah,
Yes! Oh, I was like,
I
"Oh
think
my."
the same.
Yeah,
80s, yep.
80s, okay, 80 but then now, Dr. Robbins, I'm looking at girls, like, that just they look older, like, they've had so much stuff done, and I'm like, You're
Yeah.
40 and you're 20.
Yeah, I have some thoughts about that, but what do you think about the '90s? I mean, how I can't ask your age,
This
that's so
yes, you
weird,
can.
but
I'm 44. I'm gonna be 45.
okay. You
81 days.
remember the '80s, you remember okay, how far back can we go?
I was
Um,
there. Okay. Yeah.
what do you associate with the '90s?
I don't know. I felt like more grunge. I felt like Alanis Morissette. I felt like this. I just thought thin, chic, that like very like
Kate
not as
Moss?
Kate Moss. Nothing tastes as good as skinny feels or whatever she said. But I just felt more like the grunge, less like 80s makeup. I don't know. Maybe I'm
But
wrong.
there were Baywatch boobs. I mean, there were, like,
No,
breast dog volumes were off the chain in the '90s. They were big, they were big.
you're right. The high profile. See, another thing about me is I grew up at the Playboy Mansion. So I was used to all of these naked women and like, my dad's a bodybuilder. So the aesthetics of like bodybuilding and a Speedo and the naked women are it was just normal for me. So I would be like, oh, that's a great lat. Those are great calves. Oh, that's a great high profile boob job. Like, and I'm like 14 years old. People are like, what is
True
this?
connoisseur,
What? I know. And I'm like, that's why I haven't done too much to me yet. Cause I'm like,
aficionado.
efficient.
No, so I don't know. I think those same things. Like the '90s, I think of big boobs. I think of early aughts as like I might say that would be my favorite. I think of teens as being like Brazilian butt, and especially like South Central America, like a lot of big butts. I'm just generalizing. I mean, I'm just like making associations, and not that it's necessarily true, but I mean,
No,
when we think about contemporary trends, I think you're exactly right. I see some really advanced facial aging, especially where people are are losing massive amounts of weight. I mean, the semaglutides and the GLP-1s have really helped put massive weight loss into a lot of people's. They've made it very achievable for a lot of people, but we're seeing the facial aging, the advanced facial aging, and then the flip side of that, I think people are compensating for that volume loss sometimes with just too much filler. I would say the early 2000s. I don't know.
or the
I like
worst. You're
no, the best.
the best. Okay. Love it. I love it.
I just can't think of like an early 2000s trend that I was like, "Ooh, that was awful," you know?
Yeah. No, I feel like it was like J-Lo, natural, like, I don't know, whatever.
Yeah.
Yeah, like,
The blabber went too big, it's fine.
no, it's real butt. I don't know. Yeah, like
Yeah.
yeah, real good. Okay. Okay, now what about bougie or over the top plastic surgery trend right now?
Know that I have a good answer for that one. Um, let's see. I made a few notes.
I love it. What about the big butts? Like, I feel like big butts were never in. Kardashians came in, and now it's like these big butts.
Feel like that trend is on the decline. I
Okay.
don't I don't know. I mean, we're seeing our market here just like Southern Cali's seeing a different market. Um, I don't know. I mean, I know that that's still popular. Miami's still the Brazilian butt capital of the world. But I'm hoping that's a thing of the past. I don't know. I think the biggest trends I'm seeing now that I don't like don't have to do so much with outcomes as much as just like obsession with details that don't matter. I feel like we see that a lot.
Mm,
And maybe it's a trend associated with social media. I don't even know. I love my social media. Don't get me wrong.
love it.
Or maybe just access to information on the internet. But a lot of times people are asking like super advanced technical questions. Like you and I were just talking about breast augmentation being super nuanced. And I think that's especially true where planning is involved ahead of time and implant selection, making sure, we have so many implants available to us now with regards to shape and surface and gel type. And we can really customize outcomes better than ever if you understand how to use the different tools and the different implants appropriately. But I have patients coming in sometimes who don't understand all of the details, but they might think they do. They've been reading or
Mhm.
oh
Yeah.
yeah, profile matters, but you let us worry about that.
Yeah. Yeah, that's why they would come to a pro like you. Absolutely. Yeah.
So I don't, that's not really, I can't think of a good answer to that question. I can't think of something right now that's contemporary and bougie. I don't know. Have you seen something that I don't know about?
The bougie?
Yeah.
Well, why does everyone's face look alike? I watch all the housewives, right? And all of them look exactly alike now. And I'm just like, what is this? And then their faces just don't move at all. Like I just miss the days of like faces having, some wrinkles,
Some
and like
animation?
yeah, some animation. Like what you said, like when you have some stuff, it's like, painting a wall and having a fresh coat of paint, or like you say, looking rested. That's one thing. But like I'm talking to people, Dr. Robbins, and they just don't have any expression. I'm like, are you laughing right now? Or are you crying? I'm just like, to each his own, fine. But I'm just like, I miss the animation of a face. And I'm just like, is that
Yeah.
like a regal bougie look? I don't know, but it's not my favorite, a face that doesn't move.
Yeah, yeah. I think a lot of it's non-surgical too. I mean, fillers and neurotoxins are awesome tools. I mean, we have 3 injectors in the practice. I'm a proudly take my own medicine there too. Um, but I think like any tool, it can be overdone. And I think where we're seeing these static and faces, I mentioned this earlier, where we're compensating for volume loss and weight loss patients with filler. It's a great tool to a point, but once we start getting into the phase of our lives where we're aging so much that we don't have good elasticity in our skin or good soft tissue elasticity, the filler can oftentimes look lumpy. It doesn't animate, as you said, like regular fat or soft tissue. So I don't know. I don't know what's trending. There's always, some extreme online that people are doing, but in general, I don't get a lot of requests for that sort of thing.
Has there been a case that if I said to you, I want, like my eyebrows raised, I want my nose, I want my foot, would you be like, Shauna, just let's do one thing at a time, or talk me out of something? If I was like, no, this is what I want. I want it now. Like Veruca Salt. Like,
Yeah.
I want it now. What would you like if I want my lips this big, doctor, or like really big, duck face? Would you be like, let's take a moment?
We tell people no daily. I mean,
Oh, cool.
yeah,
Yeah.
it's super. I mean, it's part of the job, right?
Yeah. Hmm.
In general, we want to make sure that what we're doing is safe. And sometimes, probably the most common reason we tell people no and we screen on the phones is to make sure they're not too obese or fat for a particular procedure. Because certain times that can put people at risk for infectious or healing complications. Um, Other medical issues can put people at risk. And then what you're describing, people just requesting stuff. The term I like to use is just marginal benefit, right? If you're a pretty 40 something and, maybe we could make something look a little different, is the benefit really there? Because the recommendation to offer any medical treatment to anybody is just, it's a matter of weighing the benefits versus the risks. And we think a lot about the risk side, but we don't always think about the benefit side. Like, what's the benefit? If the margin for benefit's really narrow, it's not worth it.
I love that. I love that. I love that. Okay, I have a daft question, little silly question, but is there a fictional character that you look at and you're like, oh, they could benefit from a little bit of a lift or a zhuzh? Anybody fictionally?
Fictional, I don't know. A lot of the fictional characters I think of are actors. I don't want to pick on them. Um, they might be your neighbors. Um, but I don't know, like animated characters or something.
Yeah, like yeah, like who was I looking at the other day? Like, I don't know, Willy Wonka, and I don't know, like one of the parents in that. I don't know, just
Did you
someone
just
that
watch
just
Willy
always looks
Wonka?
rough or grouchy, or I've
That's
got
two Willy
4-year-old
Wonka
twins.
references.
Yeah.
Did you just watch Willy?
Thank you. You're so good. Yeah, I've been watching it a lot, let me tell you. So, next time we talk, I might be singing "From the Hills Are Alive" with the Sound of Music.
No, I like it. I'm reading it right now, actually. Again,
Oh, that's
I'm
cool.
reading Charlie and the Fabrica de Chocolate.
Ooh, look at you.
I can only read children's books in Spanish, but I'm working on it.
That's
Um,
awesome. That's awesome. That's smart, actually.
But no, I don't know. I mean, Pinocchio needed a rhinoplasty, I think.
Well, that's good. There you
It,
go. There you go. Poor guy. He needed a lot.
um, I think, well, Jessica Rabbit, she could have used a breast reduction. Yeah, these days I think Jessica Rabbit would benefit from an implant exchange and mastopexy. Those have been in there probably 40 years by now, do you think?
For everybody out there that doesn't know Jessica Rabbit, Google her. Yes.
Yeah, I guess that
The
makes
way
me old.
she moves. I love it. No, I get the reference. I love it.
Disney princesses look weird, don't you? Do you think? What do you think about the contemporary Disney look?
I agree. I agree.
These
I think
giant, disproportionately large eyes with this like
no, you're right.
diminutive mid face kind of thing. I don't know. It's kind of weird looking.
No, you're right. No, that's a good point. Disney everything is just hard to explain. So,
Barbie's
yeah.
pretty hot though.
How many surgeries would it take for Barbie to look like that,
I'm
though?
just kidding.
But how many would it take? Like, how many would that take?
To look
Like,
like Barbie?
yeah. I was like, I wanna look
Oh,
like Barbie.
I don't know. I don't know. She's a little, she's poorly proportioned, I guess. I don't know.
She'd fall over, yeah. Okay, I have 2 more questions for you because this is so much fun. I could keep you forever, but I know you're a very busy man. Okay, so if I were to become an undercover spy and I didn't wanna look like me, what would you do first to my face to change it?
Hair and makeup, cheap and easy.
Really? You
Go
wouldn't do
in,
my nose? Or,
go
like
into a bathroom and cut your hair off in the bath in the sink and dye your hair. I think I've seen that in a lot of
like
movies.
La Femme Nikita? La Femme Nikita yeah, okay. I'll go do okay, so you're telling me I could just get a 9.99 box of dye and some scissors, and I
I
don't
would if you should glue a mustache right here.
oh, good point. Okay, I'll start.
No, I don't know. I think it depends on the person. For you specifically, I don't know. I mean, how could we make you look different? Probably, yeah, we could do some weird things to you, kind of make you. I need more specific order. You want to look more masculine. You want to more this or that. I don't know. What do you want?
I'll get back to you on that, but yeah, that's interesting. I guess what kind of situation I'm in because 'cause I'm always like, "Oh, I had to change," or people wanna change their identity all the time. How do they get away? Nobody can get away with murder anymore. That's a good thing.
Do you
But
fantasize about this? Is this like
I
a
watch a
living
lot
off
of
the grid?
murder. I watch a lot of murder, Doctor Robin. Don't judge, but I'll watch a lot, and I'm like, "How do they get away with it? How do they hide for so long? Like, what is happening?" Yeah. No, no, I went to school to be an actor, so I kinda know those roles of, like, being a different person, but no, wouldn't wanna change it, but no, you're funny, though. Okay, wait, last one, last one. What is something you never want someone to say after a procedure with you?
Genuinely, it hurts my heart if someone says or were to say that I didn't care, that my staff or I didn't care. I think we care deeply. I think we take our job very seriously, and that would hurt. That would hurt my feelings a little bit. Um, if people say they have regrets, that hurts my feelings. We never want people to have regrets, but I mean, regret can look like a lot of different things. It could mean, you didn't get to take your cruise uh, to, out of Miami on time or something. I don't know. I don't know.
Right.
I don't know what it looks like, but generally, I want people to be happy with their outcomes and whatever that does for them.
Well, I love that. And again, I'm going to put your social media handles on this podcast because your staff is amazing. Like they just look like they really do care, and you guys are fun. And it just seems like an office that's so approachable, and you just seem like a great guy and surgeon. So I want to thank you for talking to me because there's a lot of people I talk to where I'm just like and now I'm like with you, I just geeked out, and I think everything you said was just so spot on, and when I come to Nashville, Imma come see you. May give you a hug, may not wanna be maybe I'll find out if I wanna be more masculine or do something with my spy feel and look later on. Maybe I'll stay the same. I don't know.
Weird.
Like total
Facial tattoos, Shauna. That would be a good look.
There you go. Perfect. Okay.
I'd love it if you come to Nashville. I'd love to see you. You've been entertaining, charming, and lovely. All the above. Enjoyed hanging out with you.
Good. Well, I'm sure people are going to have a lot of questions. So if I get lots of questions, I would love to talk to you again because I learned a lot
Send
today.
us a
So,
list.
thanks, Dr. Robbins. Well, thank you for everything. I'll put all the information on and we'll talk soon. Appreciate
Sounds
you.
great. It's been a
Okay.
pleasure, Sean. Thanks.
Thanks. Bye.